Hi everybody. In this video, we're going to continue looking at the restorations, general restorations, and in this video we're going to look at mold, skin slip, missing or twisted limbs, discolorations, a wide variety of restorations. Now, mold is not something you run into very often. On this body you can see the white areas, that's mold formation. Now, mold, if you get a body that has mold on it, first thing you have to do is get rid of the mold. So you have to take the mold off. Now that can be taken off with a 1% solution of creosote. Not sure where you're going to get creosote, but this is in the curriculum, so I got to tell you. You could use 1% phenolic. So this is pure phenol, but you could also use the watered down version of mortuary bleaches. You could also use half methyl alcohol and half acetic acid. Now the acetic acid you just get from vinegar. The methyl alcohol, wood alcohol, not really sure where you'd get that. You might be able to get it like Farm King or something. But really the easiest one to use in a funeral service setting would be the phenolics. So that would just be your mortuary bleaches. You just water it down a little bit and you just brush it onto the mold and then wipe the mold off. Now, once you do that, those affected areas are going to be depressed because it's going to be like an abrasion. The mold is growing into the epidermis. And so when you take the mold off, the epidermis is also going to come off. So it's going to be depressed and it's going to start to dehydrate, just again, like an abrasion. And that's basically how we treat it. The restoration would be like an abrasion. So if you're the one taking the mold off, if the tissue has not browned yet, dehydrated yet, I would apply a compress of mortuary bleach to it. So mortuary bleach compress, can't talk today, to those affected areas that will help to sear them and even get rid of some of the discoloration from the drying out. Again, you would make sure that there's no spikes coming up off of it, so very light sandpaper or an emery board you can do that with. Then you could put, if it's in a visible area, some opaque cream cosmetics underneath as an undercoat, powder that, then wax it with soft wax. Next up is skin slip or desquamation. Again, this is going to be very similar to an abrasion treatment. So that's what it looks like. Okay, this is all skin slip here. Okay. Now, skin slip can be caused by edema. Really, edematous tissue can cause skin slip. You can get skin slip in elderly people just because their epidermis is hydrolyzing away from their dermis, just because they're old. You can get it from decomposition. So you'll run into skin slip quite a bit. So when we treat skin slip, they suggest hypodermically embalming the unpreserved areas. So you could either do arterial solution that you're using to embalm the body with. You could hypodermically inject cavity fluid to the area. You could even hypodermically inject phenolics into the area, so mortuary bleaches, just to make sure that the area is well preserved. Any epidermis that is loose, you're going to take that off. Again, a lot of people try to keep the epidermis on and get it back in place. It doesn't work. It never lines up because it's kind of dried out. So just take that epidermis off, much like removed tissue of any kind. We're not going to throw that away. It's going to get buried with the person. They suggest using a cavity fluid compress or gel to the area, which is fine. In this case, that will help to preserve the area. Again, I like mortuary bleaches for this, just to cauterize it. The surface tissue, again, you should sear with a cauterizing chemical. Again, that's why I use the mortuary bleaches for this. Or you could seal it with a liquid sealer. Now, technically, I do both. For skin slip, you can anyway. You can sear it with a cauterizing chemical to make sure that it's not going to leak. The liquid sealer doesn't really work well to keep things from leaking if they're already wet, because the liquid sealer won't stick to it. So I would cauterize it first and then, okay, and seal it with liquid sealer. Then you're going to restore it just like an abrasion. Again, make sure it's smooth. If it's discolored, you'll put an undercoat on, then a thin layer of surface restorer / soft wax. Now, tumors, ulcers, or lesions. Now, lesions kind of a generalized term for anything that's weird on the skin. Ulcers are depressed lesions, and tumors, it kind of depends on what kind of tumor it is. A malignant tumor would be fixed much like an ulcer or a lesion. A benign tumor is a little bit different. So these may require excision of tissue. Now, most of the time, ulcers and lesions are not necessarily on viewable areas. So like bed sores, that's an ulcer. That's usually on the back of the body somewhere, and it's not in a visible area. You do treat them to make sure they don't leak and smell, but you're not going to restore them necessarily. But if you have a tumor, especially in a visible area, okay, that may require excision. So prior to embalming, you would excise the tumor if it's affecting surface contour. So these would be the benign tumors. Benign tumors grow just by expansion; they just get bigger. And if this is in an area that's visible, you would cut that benign tumor out prior to embalming. You may have to temporarily suture tissue in place, then embalm the body. Now you would excise the tumor or lesion after embalming if it's necrotic or leaking, and that's usually malignant tumors. Malignant tumors are always done afterwards because they are kind of necrotic. Now again, if these tumors are not in viewable areas, you don't do any excision of them. You just leave them alone. You'll treat necrotic tissue or malignant tissue. You don't have to remove it necessarily, but you will treat it like an ulcer. You'd cauterize it, make sure that it's not going to leak, wrap it in plastic, things like that. But again, this is excision done if it's in a viewable area. And obviously, if you're going to excise tissue, you need permission to do that. Then if there's any pus or anything like that, or gas, you'd aspirate that prior to embalming. Again, if there's pus, you don't want it to explode, but either pus or gas will put pressure on tissue, and that's going to affect your distribution. Then you would hypodermically treat the deep tissue of that area. And this is done for all of these types of tissue. Again, if it's in a non-viewable area, you'd still do this. And that's mainly to not only preserve the tissue, but also to kill off any bacteria in those tissues. Ulcers and malignant tumors always have lots of bacterial infection. And so if you're going to excise those things, you have to be really careful not to infect yourself with any of that bacteria. Now, the treatment or restoration of these things would be like deep wound restoration. Again, excising tissue, cauterizing it, fill it up, basket weave suture, wax. But this is only done if an excision took place. So if you didn't excise any tissue, you don't have to worry about it. But if you did excise tissue, then you'd treat it like a deep wound restoration. Now, sometimes you have amputations that come in. I've only had this a few times, but someone had a limb amputated, they died, they'll send the body with the limb to the funeral home. So treatment, we're going to store if this is a twisted limb, so like a spiral fracture, you're just going to put it back in normal position. If it's severed, then you're going to embalm, much like a decapitation. You're going to embalm the limb and the body separately. Once you've embalmed it, then you can put it back into normal position. So you embalm everything, limbs, body, the whole thing. Any areas of open flesh, you're going to cauterize, and you're going to use mortuary bleach to do that. You don't want it to leak. If there's any depressed areas that would be seen, which is pretty rare because it's going to be covered by clothing, but if it's going to be seen, or if it really affects the surface contour, you'd elevate those depressed areas. Again, you could use putty to do that. I would probably use cotton and mixed with liquid sealer as a binding agent. They do recommend that you put plastic undergarments on these severed limbs, especially because of leakage. I don't like plastic undergarments. I just use saran wrap and shrink wrap to do that, and duct tape. Now, most of the time, this is about all you really have to do with severed or twisted limbs. Just get them in the right spot and make sure they're well preserved. But if there's a missing limb, you may make a plaster Paris representation of this. We actually had a guy once whose limb, his arm was crushed in a motor vehicle accident, so we couldn't use the arm. It was run over by a semi. and so it was crushed. It got buried with him, but we recreated his hand with a mannequin's arm, really. And we told the family we were going to do that. But we we used the mannequin arm, but then recreated a hand out of chicken wire, and then wrapped that with cotton soaked in liquid sealer, then waxed that and recreated a hand out of it. So depends on why the limb is missing and kind of how long it's been missing, whether or not you would do this. There could be some deep wound restoration if there's parts of the limb that are missing, and so you can bridge those areas, much like you would a decapitation. Truly, that you wrap it, you'd bridge it with a splint, and then wrap it with plaster Paris bandages. Wait for that to dry, coat that in liquid sealer, and wax it. Again, so you might just have some waxing to do too. All depends on how severe the damage to the limb has been. And lastly, in this video, we're going to look at discoloration treatment. So the treatment for discoloration is bleaching. Again, you use mortuary bleaches for this for the most part. This is an example. So this is a bruise that was then bleached out. You're never really getting rid of the bruise entirely, but it is easier to cosmetize areas that are lighter than areas that are darker. So that's one of the reasons why we bleach it out. Now there's two ways of going about bleaching things. You can use surface bleaching, so a compress, cotton soaked in some kind of bleaching agent. That's how I like to do it. Surface bleaching tends to be a lot more thorough. Okay, so put a little star by that one. That's the way you should do it. It may involve, so there's an and/or hypodermic bleaching. That's injection of bleaching agent directly into the tissue. That's not as effective because it leaves streaks. It doesn't tend to be as even. And so I prefer surface bleaching to hypodermic bleaching. You might have to do both if it's severe enough, but usually surface bleaching is good enough, but it takes time. So that's one thing to take into consideration. You have to let that bleaching chemical sit for a while. The restoration is pretty easy. You've bleached it out. You may have to do an undercoat for dark discolorations. So if you are cosmetizing over a bleached area, one of the things you can do is take the cosmetic that you're going to use for the foundation cosmetic. Foundation cosmetic is the recreation of the person's natural skin tones. Take that cosmetic you're going to use and the color you're going to use, lighten it just a little bit, put that as an undercoat, and then cosmetize over top of that. Again, it's going to help to hide that discoloration. Now, depending on the discoloration, could kind of depend on how you get rid of it. So there's a lot of external stains that we have to get rid of. And we've seen this before. This is just a little reminder of these things. So these are external stains. Adhesive tape is pretty common from people from hospitals. Rubbing alcohol will take care of that. You could use ether too, but I don't just have ether laying around in the prep room. But rubbing alcohol is easy to get hold of. Blood's pretty common. Just soap and cold water will get rid of that. We want to get rid of these, all of these surface discoloring agents before embalming, remember. Creosote, pretty uncommon. But if a person happened to have that on their skin, you would use gasoline to get rid of that. Yeah, now I've got a body that smells like gas, so that's a bit of a problem. Things like creosote, grease, things like that. I've mentioned this before, but you could probably get rid of those things with stuff called goop, is what they call it. But that's what mechanics use to wash their hands with. That gets rid of a lot of those organic-based discolorations. Grease or oil will come off with trichloroethylene. Problem with trichloroethylene, they don't make it anymore. It's very what's the word I'm looking for? Toxic, and so they banned it. It used to be great stuff, but they don't make it anymore. It's still part of the curriculum, so I still have to tell you about it. But again, the goop stuff would probably work really well for that. Iodine's a pretty common discoloration on hands, especially from IVs and things like that. So to get rid of that iodine stain, alcohol works really well. Rubbing alcohol will take it off. You could use bleach, but again, we don't want to use bleach in the prep room. If the body has ink on it, you can get rid of that with acetone, so fingernail polish remover, as long as it has acetone in it. Lacquer, which is used in woodworking mostly. If the person has that on their hands, acetone will take that off also. Nicotine stains, pretty common on hands. Lemon juice works really well for this. I've actually taken nicotine stains off people's hands with lemon juice. Again, you could use sodium hypochlorite or bleach, but we don't want to use that in the prep room. Paint, not uncommon. That comes off with paint thinner, so turpentine. Again, problematic a little bit because turpentine does have a smell to it. And then tar. Again, you're not going to get a lot of bodies with tar on them, but who knows. But that can come off with benzene. I wouldn't use benzene because benzene's been linked with leukemia. Not even sure where you'd get benzene, to be honest with you. It will come off with kerosene. Kerosene's easy to get, but then again, now I have a body that smells like kerosene, so that's a bit problematic. Okay, so that finishes it for this video. In the next video, we're going to look at hair restoration.